when you look at a bone and compare it on an X-ray, bone, X-rays. Bone is seen on X-rays. The cartilage is not. And bone is covered by cartilage at the top, bottom. If I look at a pediatric bone here and compare one-on-one on the X-rays, this is metaphysis. This is the most common location for infections and tumors. This is diaphysis, also called as the middle of a bone. And I want you to remember one disease here, Ewing sarcoma. Towards the end of a bone is the epiphysis. And it's covered by cartilage on the bone, but this is not shown on the X-rays because X-rays are not showing the cartilage because it's radiolucent. The upper end means epiphysis, the metaphysis, and in between is the growth plate called as physis. Good thing about physis, it's also made of cartilage, so not seen on X-rays. Bone, look here, bone. That's how you write bone. It has a word 1. So bone has 1. So it has type 1 collagen. Cartilage, you can write it like this. Cartilage. It has 2. So it has type 2 collagen. So metaphysis, most common area for infections and tumors. Diaphysis, mid of a bone, Ewing sarcoma. Cartilage is not seen on X-rays. That's how you compare bone on X-rays. Bone has got majority of inorganic component called as calcium hydroxyapatite. It's called as Ca10PO46OH2. Sometimes it becomes Ca5PO43OH minus. So this is half of Ca10PO46OH2 minus, and then you have 35% as organic component, in which I already told you. In the organic component you have type 1 collagen. Bone has 1. So when you look at the matrix, you have proteoglycans, which will give you the compressile strength in the organic component, and then you have the collagen type 1 that gives you the tensile strength. Tensile strength is by collagen type 1. And then you have non-collagenous proteins like osteocalcin, osteopentin, osteonectin. So these are bone formation markers. Osteocalcin is a very, very important bone formation marker. Another bone formation marker is bone-specific alkaline phosphatase. So type 1 collagen, tensile strength, proteoglycans, compressile strength. Another thing that you should remember, when you have an immature bone, it's called as osteoid, and the mature bone is called as osteon. It's also called as the mineralized bone. You look at this image, when we look at the epiphysis, the physis, and the metaphysis. The age at which the physis disappears and the epiphysis fuses with the metaphysis is called as the age of skeletal maturity. So in skeletal maturity, we need to remember 6 joints. 3 joints of upper limb, shoulder, elbow and wrist. 3 of lower limbs, hip, knee and ankle. So when we look at this skeleton, 3 joints, they look up towards the God, the Almighty, and when you look up, you grow more. So these 3 joints, they ossify at the age of 18, and 3 joints, they're looking down: elbow, hip and knee, and the ankle. So elbow, hip and ankle, they look down, so they ossify at the age of 16. So those who look up, they grow more. Shoulder, wrist and knee. Those who look down, finish early. Hip, ankle and elbow. 16 years. One of the commonest question here, elbow ossifies at what age? So elbow, 16 years. Remember this. Looking at the different areas in the bone, we will start from the top and then go down. When I look at the top is the cartilage. Cartilage type 2 collagen. In cartilage, the superficial zone, the top zone, has very high amount of water, and water and proteoglycans, they go opposite to each other. The top zone also has got a good reservoir of cartilage cells and high density of chondrocytes. Just beneath the superficial zone is the thickest zone called as the transition zone. Here you have cartilages in low density. You have often seen that. Just beneath the plenty deficiency is there. That is zone 2. Zone 3 and 1 are opposite. Zone 3 has active chondrocytes but low water, high proteoglycans. I told you water and proteoglycan has inverse ratio. And zone 4 is next to the bone, so it will have the calcified cartilage. This is about the cartilage. Then the epiphysis. Next to the cartilage is the bone, the epiphysis. There are 4 types of epiphysis. The joint forming, like the head of femur, head of humerus. These are pressure epiphyses. They are formed early. They will define the joint. Just by their side are the pull of the muscles pulling the bones apart, called as traction epiphyses, like trochanters and tuberosity. So these are 2 important epiphyses. Traction epiphyses examiners love. And when we go forward, there are 2 more epiphyses. One is aberrant, which is not of much significance. And last is atavistic, which was separate in animals, but in human beings it became fused, like the coracoid process to the scapula. So coming to the pressure epiphyses, they are in the joint, weight bearing. Traction epiphyses, also called as apophyses, extra-articular trochanters of femur, tuberosities of humerus. When I look at the rotator cuff muscles which sit on the tuberosities, they are remembered by the mnemonic supraspinatus, infraspinatus, small t for teres minor, sit, a dash, because supraspinatus, infraspinatus, teres minor, they go on greater tuberosity, and then a small s after a dash, because subscapularis, they go on the lesser tuberosity. So I made a dash. You know, subscapularis is the internal rotator. The other 3 muscles are external rotator. So if I place the back of my hand over the lower back and try to lift it up, this is extreme of internal rotation, called as lift-off test. Subscapularis. Where the other 3 muscles, they go for external rotation. One more catch here. Small t means teres minor. So that in exam, you don't get confused. So exam, you don't write preparation, you don't write mnemonic like this, sits. You also don't write mnemonic like this, sit dash s. You write mnemonic like this. Small s, subscapularis, small I, infraspinatus, small t, teres minor. Then coming to aberrant epiphyses, they are accessory ectopic epiphyses, like the head of first metatarsal or base of 5th metacarpal. And atavistic, I told you, coracoid process which become fused in human beings. Growth plate, the physis, bridged between the epiphysis and the metaphysis. So we have got the resting zone, the zone of reservoir, storage disorders that affects it, like Gauchers. This is just beneath the epiphysis. Then you have the multiplying zone, affecting the dwarfs and giants, proliferative zone. One of the examples, growth hormone deficiency, Laron syndrome. This is involved. Then you have zone of maturation. just beneath the proliferative zone. That's the zone from which the fractures occur. So physeal injuries in children, it involves this zone. And the last one is closest to the metaphysis, zone of calcification affecting rickets. Remember, beneath that is the primary spongiosa or the bone where scurvy will affect, because it affects the cross-linking of the collagen. So scurvy will affect the spongiosa or the primary bone. That is how the growth plate is classified. Stages, different zones. Thank you.